what kind of bladder problems affect people, and particularly when people get older. The first thing to think about is something called stress incontinence, and that is incontinence in response to physical exertion. This is a kind of incontinence that's the commonest kind of incontinence in women, but affects men, particularly following prostate surgery. Basically, a change in position, physical exertion, or a rise in the pressure in the belly causes the valve at the bottom of the bladder to leak. This is due to a problem with the valve at the bottom of the bladder or a problem with the pelvic floor. The pelvic floor is that sheet of muscle which lies at the bottom of the pelvis and keeps the internal organs in place. It's also very important because some of that muscle forms the valve at the bottom of the bladder. So leakage, while coughing, laughing, sneezing and moving around is a symptom associated with stress incontinence. The next kind of incontinence, which is possibly the commonest form of incontinence affecting older people, is called urgency incontinence. Urgency is described as a sudden, strong desire to pee which is very difficult to defer. Sometimes it's so severe that people are incontinent even before they realise it. And urgency is a very common symptom. Urgency itself is both a problem with the bladder. The signals from the bladder to the brain are, if you like, louder than they used to be. And an older person's brain is less good at suppressing that noise than it used to be. Such that, combined with the changes in bladder sensation, the ability to hold on in the face of urgency becomes very difficult. About half to 2/3 of people will be incontinent as a result of urgency. So, what does urgency lead to? The first thing is that people tend to restrict their fluids, and we'll talk about that in a little while. The second thing is they tend to put up their frequency. If you have an empty bladder, then you shouldn't get urgency and you shouldn't leak. And then that means that the bladder becomes a low capacity, high frequency reservoir for urine, rather than the higher capacity, low frequency bladder that it should be. The next problem is, of course, that people can have both things at once, and this is called mixed incontinence symptoms. And this too is treatable. Men as we said, get different problems from women. Men tend not to have stress incontinence unless they've had prostate surgery, but they do get more problems emptying the bladder than women until very late life. Emptying problems which include a very slow stream, hesitancy, so there's a delay between standing at the toilet and thinking pee and the pee coming, the need to strain, and a stream that might be weak or go in stops and starts. Likewise, there can be a sense of incomplete emptying. You finish, but you realise your bladder's still somewhat full. And these are what are called voiding symptoms. The symptoms of frequency, urgency incontinence, and stress or exertional incontinence are what we call storage symptoms.